It's a simple glass of water, but for many, drinking it is a hopeless task. Some older or infirm patients struggle to drink from conventional cups and mugs, which can leave them feeling helpless. And if patients don't drink enough, it can cause health issues. Dorset HealthCare is trialling a new system in its community hospitals to help hydrate patients who may find it difficult to drink by themselves. The Hydrant is a new product which is designed to allow patients to be able to take on fluids without assistance. The water bottle can be clipped onto a wheelchair or to the headboard of a bed, and via the straw system patients can drink unassisted with minimum effort. The Trust hopes that by introducing the Hydrant it will help to shorten the time these patients spend in hospital. Nursing staff agree.
It affects different patients in different ways. We've had patients that aren't able to hold a cup and they can drink quite easily now, and they're much more positive about drinking, and they're more aware of how little they sometimes drink.
You often feel thirsty and just do nothing about it. I've been told frequently and frequently ignored people who say I should drink more. I certainly don't drink enough.
Well, I was a bit sort of, well, what is this for a moment? But directly I realised what it did. It immediately boosted me. I thought, well, yes, this is what I'm waiting for, is because it's so easy to handle.
Although I was told that I never drunk enough, but you can easily by just...
I've lost basically all my eyesight. So all I've got a little bit, and if I move that hand, I could knock things over because I can't see it. But having it here, it's so convenient and handy all the time. Just put it in your mouth and it's easy to drink from.
I think I'm drinking more water because it's always there. And also I'm happy that it has a cap on it so that it's not exposed to the elements.
From my family point of view, I know that they would be thrilled to bits with the fact that I'm now able to get us a drink without having to get up and get out of chairs.
I will certainly keep on using it. You've got access to it all day, wherever you are. So if there's no one around, it's quite easy to just pick up the tube and have a drink.
It's going to give the nurses more time to care for the ones that are really want the care rather than just running around to give someone a drink.
My impression of the Hydrant is I think it's a really positive thing that's come in that the patients can have their water bottles, they can walk around with them, they can put what drinks they like in them, and they can own their own bottles. Encourages them to drink more, and also it is lowering the incidences of urinary tract infections. Because the bottles are marked, we can see how much the patient is drinking and we can refill them accordingly. They can take them into the therapy sessions. They're not spilling the drinks as well, so we can see more accurately what they're drinking.
Staff have seen that they're not having to fill up jugs quite so often, that there's not so many spillages of drinks, and that the patients are drinking more.
I would like to think that when the trial ends, we would continue to use it and get the benefits that we've got already, and that it'll improve patient care.
I'd like to see it in every hospital. There's nothing to lose and everything to gain.
Use it, because it is excellent. Yes. You know, I've never found anything so easy to drink out of. I didn't think I'd be able to bring it home, you know, but it's ideal. I do carry on using it now all the time.